In 1848, an outbreak of typhus was ravaging Upper Silesia, a poor rural community in what's now considered modern-day Poland. Today, we know that typhus is a bacterial disease spread through contact with infected body lice. But back then, we mostly just knew that it was killing a lot of people. To learn more about the disease's spread, government officials sent a bright young German pathologist named Rudolf Virchow to investigate. In a 290-page report detailing his findings, Virchow came to a groundbreaking conclusion. He proposed that there was a strong connection between the spread of disease in the region and the poor social conditions in which people lived. Today, we're going to break down every single page of Virchow's report and... oh, what's that? We're just doing 2 sentences? Thank goodness. Virchow wrote that if medicine is to fulfill her greatest task, then she must enter the political and social life. Do we not always find the diseases of the populace traceable to defects in society? Okay, translation. When it comes to when and how we maintain our health, society is kind of a big deal. And today, we're going to take a look at exactly what defects in our society Virchow was talking about. Turns out these defects are connected to the social determinants of health, and they are deeply connected to one another. Hi, I'm Vanessa Hill, and this is Crash Course Public Health. I want to note up top, for the purposes of this episode, we'll stick with the basics of this incredibly complex topic. So let's start here. We exist in a society. Over at Crash Course Sociology, we define society as a group of people who share a culture and a territory. Everything we do in our society. We shop, date, and bathe in society. And in general, society has also done a lot to improve our health by making things like sanitation, healthy foods, and affordable housing more available. Improvements like these are a big part of why global life expectancy has increased so much over the last few centuries. Like, up until around 1800, the vast majority of people on Earth lived in poverty, and infant mortality was extremely high. Overall, not a single country had an average life expectancy over 40 years. But as we got better at building societies, we got better at helping people live longer. As of 2019, the United Nations estimates that the average global life expectancy is over 72 years. Though we should note that was pre-COVID. And life expectancy hasn't increased in the same way in every society. While society-level improvements can improve the health of the general population, they don't always do this equally. The impact of these improvements often varies according to things like race, ethnicity, class, gender, and disability. To understand why, we need to start by looking at the living and working conditions in which we spend our time, and which impact our health. We call these the social determinants of health. Now, some of the social determinants of health might feel pretty obvious. Like, we don't need to be a discerning 19th century German physician to know that a society without access to food probably isn't going to be a society for very long. But just because a society has food doesn't mean that equal access to healthy foods is a given. A food desert is a neighbourhood without easy access to fresh foods like fruits and vegetables. Rather than fully stocked grocery stores, residents in these neighbourhoods might have to rely on convenience stores, gas stations, and fast food restaurants. The lack of consistent access to enough affordable, healthy food in places like food deserts is called food insecurity. It could be difficult to access food because it's physically far away. For example, developers may be less incentivized to build fully stocked supermarkets in low-income communities where people have less money to spend in stores, making the nearest grocery store a long bus or car ride away. But healthy food may be hard to access because it's just too expensive. A survey of 11 southern African cities by the African Food Security Urban Network found that even in poor neighbourhoods where food is physically nearby, on average, 57% of families in these neighbourhoods still reported limited access to healthy food. This suggests that the problem isn't always a matter of distance or convenience. Sometimes food is just so expensive that the cost prohibits families from accessing it. And while we're discussing food, we might as well talk about another element of Survival 101. Shelter. Stable housing is a foundation for good health. Evidence suggests that people who experience housing instability, like being behind on their rent or mortgage, moving for cost reasons, eviction, or experiencing homelessness, are more likely to self-rate their health as poor, and are more likely to experience depression and anxiety. These experiences are stressful, and data suggests that this stress is partly responsible for the relationship between housing instability and health. Like food and shelter, being able to regularly and reliably access health services, like a doctor or pharmacy, is key to preventing disease, treating health conditions, and reducing the likelihood that we die early. So, public health experts consider access to healthcare to be another key social determinant of health. Much like life expectancy, in the grand scheme of human history, healthcare has sort of never been better than it is right now. Innovations in science and medicine mean that we should be better at managing and curing disease than ever before. But like with the other improvements we've discussed, we haven't managed to make these advancements accessible to everyone. For one thing, to receive healthcare, we need to transport our bodies to a place where our health can be, well, cared for. Yet every year in the United States, around 3.6 million people don't receive medical care just because of transportation issues. Like with food deserts, these issues might arise because of distance. Some of us live in rural areas far from the nearest hospital. But even in cities, things like traffic or an unreliable public transportation system with multiple transfers can require time that a lot of us just don't have to get to appointments. And it's not enough to just get to a healthcare provider. We also need to be able to afford care. Access to affordable and quality insurance reduces barriers to healthcare by reducing the cost of checkups, treatment, and medicine. It also makes us more likely to visit a doctor for preventative care, and less likely to delay care when we're unwell, practices which are linked to better health. For example, studies in Indonesia and Ghana have shown that access to health insurance was strongly associated with pregnant women getting checkups throughout their pregnancy, which allowed prevention and diagnosis of potential problems early on in the pregnancy. And without insurance, we're less likely to get to a doctor and to experience those benefits. And so long as we're talking about costs, nothing tells the story quite like money. Take income, or how much money a household makes. In the United States, the gap in life expectancy between the richest and poorest people is 10 years for women and 14 years for men. Another financial factor that contributes to our health is our wealth. While income is the new money we earn from things like our work and investments, wealth is the total value of all the stuff that we own, from the money in our bank account to our real estate. Whether it's our income or our wealth, money is one of the keys to unlocking all those social determinants we've been talking about. And when it comes to making money, it certainly helps to have access to quality education. Almost universally, improvements in countries' education systems have been linked to increases in their average household income. Plus, level of education can also affect the way we feel in healthcare environments. Education can give us the tools, skills, and even the confidence we need to navigate complicated things like healthcare. So while, say, a college grad with a science background might feel more comfortable talking about treatment options with a doctor, someone without that academic background might feel awkward or anxious. That may seem like a small difference, but it can impact how frequently we receive checkups and preventative care, which over time can make a big difference in our health. Education also plays a major role in our occupation, or the kind of work we do, and we generally assign a social status to that work. Like, we might say that a suited-up hedge fund manager at a bank has a high occupational status. But then there's the bank's summer intern, whose biggest responsibility is to deliver the hedge fund manager her afternoon coffee exactly how she likes it. And then there's the barista down the street who made that coffee. Their occupational status would probably be lower. And people with lower occupational status tend to be more stressed, have worse healthcare, and less freedom over how they spend their time, all of which affects their health. But in life and in public health, we don't measure people by their occupation alone. And by now, we can see how all of the determinants of health we've described so far are related. Combining the measurements of income, occupation, education, and more helps to determine our socioeconomic status. This basically tells us where we fall in the grand hierarchy of our society. It's also one of the ways public health experts group people together to better understand health across different groups. But the world isn't just made up of Harvard-educated bankers and coffee-brewing baristas. Most of us fall somewhere in between, and the details can be subjective. Let's go to the thought bubble. Our story starts with two people working at the Marsupial Research Lab at the fictional Stanchester University. Our first person is Dr. Pouches, a young, celebrated professor who is the world's leading expert on, wombats. They're the keynote speaker at the Global Marsupial Convention, the face of Wombat Weekly, and they're generally considered to be something of a wombat prodigy. Our second person is Burt, a wombat sanitation worker who specialises in cleaning up after the wombats in the lab. Burt has a high school diploma, has received special training for his role, and is working on obtaining his laboratory animal technologist certification, but he never went to college. Based on education and occupation alone, we, as outside observers, might think Dr. Pouches has the higher socioeconomic status. But Dr. Pouches and Burt might not rank themselves that way. Turns out that Dr. Pouches is struggling to get tenure at their university, while Burt has a pretty steady gig. He makes a consistent yearly salary, gets great benefits, and after a few years on the job is even promoted to Assistant Director of Marsupial Sanitation Affairs. So, in a community where job security is highly valued, Burt may consider himself in a pretty good socioeconomic position, while Dr. Pouches may not. But in an alternate scenario where Dr. Pouches had tenure in the bag, or the pouch, plus the fame, clout, and upper hand in the hashtag marsupial Twitter arguments, they may consider themselves better off. Thanks, Thought Bubble. So it's, of course, never quite that simple. There are many other factors, like race, religion, and gender, that contribute to socioeconomic status. But it's clear that different societies, communities, and individuals will weigh different parts of our socioeconomic status differently. And that can affect our access to important health resources. Understanding how and why societies and the people living in them view those parts differently, especially when it comes to our identities, is all part of better understanding the social determinants of health. Because at Crash Course, we don't just want to know that something happens. We want to know why. So maybe we can make it better. Join us next episode as we dig deeper into the social determinants of health to figure out exactly how they affect us, wombats or no wombats. Thanks for watching this episode of Crash Course Public Health, which was produced by Complexly in partnership with the American Public Health Association. If you want to learn even more about public health, head over to APHA's YouTube channel to watch That's Public Health, a series created by APHA and Complexly. Crash Course was filmed in the Castle Garrity studio in Indianapolis, Indiana, and made with the help of all of these curious people. If you'd like to help keep Crash Course free for everyone forever, please consider joining our community of supporters on Patreon.